I was in bed one day and I had pulled my sheets up and it almost felt like a pellet. I thought, oh dear, that's not normal.
1 in 8 women will have breast cancer at some point in their lifetime. And for an individual patient or person, it's about a 13% chance of developing breast cancer.
Imagine yourself getting the news you have breast cancer. The questions you have. How can I survive it? What are my treatment options? Are there any long-term effects? What's really going to happen to me? Hello, I'm Wendy Brokaw. Today, InSight goes on-site to learn how Salem Health's new breast care center is designed to help patients not only survive, but thrive through innovative programs where patients take an active role in choosing their treatment and recovery options, all under one roof. We will also learn how breast cancer treatment is evolving and how future recovery may get help from a cognitive training clinical trial at the center. And you will meet Katie Schmidt, a Salem mother of 2 who told us the story of her cancer journey and hopes it might help other survivors with their own.
The breast center has been a dream for years. Give us our unique space because it's such a great program and it's so comprehensive and we do see so many breast cancer patients. It just means so much to people to have this beautiful space where you feel well cared for with people all around you, giving you just the best treatment they possibly can.
I was actually in my truck, I was driving when the doctor called me to give me my diagnosis, which that, if I can be honest, that probably was the worst part of all of this. Is I didn't feel that he was real gentle, you know, with the news, the delivery of the news. I was told that I have cancer and the cancer center will be in touch with me and to study my cancer. And I remember hanging up thinking, okay, study what? I couldn't even remember what the name of the cancer was. So that was really hard. And my son was just getting ready to be enrolled into Central Oregon Youth Challenge program. And having to make the decision, do I tell my son the news before he goes in, which was January 11th, or do I let him go in and not let him find out until he comes home and sees me bald? So that was a really difficult thing to go through, and I had decided to wait until he came home on his visitation to tell him because I wasn't bald yet, so he was able to see me in whole. I had my mastectomy 2 weeks after he saw me in March. April 1st was my very first day of chemo. The nice thing about my first day of chemo is that they brought me in for an appointment. It's called the chemo education appointment, I think is what they had called it. And my fiance and I came in and they sat us down and told us all the things to expect from chemo. Some of this may happen, some of it may not. You're gonna lose your hair, you're gonna get sick. There's other things that your spouse needs to know. You know, we can't kiss. We both needed to know that kissing was not allowed after chemo because I could give him chemo. So I'm really glad that we had the education that we had because we don't know what the heck is going on. All we know is what we hear on TV, right? Is chemo's bad and this is what's gonna happen. So having that education was really, really wonderful.
How long is your chemotherapy treatment?
A year. So I did chemo every 3 weeks for a year. The first 6 months was 4 bags of chemo. I was in the chemo room for 6.5 hours every time. I was the youngest patient in the chemo room almost every single time. And being there 6.5 hours, you see people come and go. And it was usually, it was people older with gray hair. I was always just looking around like, oh my goodness, where are the people that are my age? Where are my people that have cancer? But yes, for a year, 6 months of the hard cancer that rips your hair out and makes you, real sick, and then 6 months of 2 bags of chemo that don't make you as sick, but it's not nice either. So a year, every 3 weeks, and now I take a chemo pill every night. I have an injection in my abdomen every 3 months it's like a chemo pellet that dissolves over time. And then I do an infusion every 6 months. And that will go on for the next 4 years because my cancer was hormone fed. So I'm still technically in treatment. So I have people ask me if I'm a survivor, talk about the survivor, and that's a really hard one for me to say. I don't think I'm a survivor yet because I'm still in treatment. I'm doing good. I'm doing really good. I'm walking every day, and I'm cooking, and I'm doing all the things that I wasn't able to do for over a year. So in that sense, yes, I'm surviving. But to say I'm a survivor, I'm not quite there yet.
What was the hardest part of all of this?
Telling my son, and my fiance, telling him, those were the hardest. My fiance was actually in Mexico when I got the diagnosis, and so I called him on the phone, and I couldn't get the words out. I couldn't say it. I kept saying, and I ended up hanging up on him because I couldn't get the words out. I was scared. I didn't know, how is he going to respond to this? How is everybody going to respond to this? Are people going to look at me as a disease now? Or, cancer is such an ugly word, and some people look at it as a death sentence. And so I was very fearful in the very beginning that I would have a lot of people just feeling bad for me, looking at me and I didn't want that. They didn't know how to respond, and they just cried, and they were more upset than I was. And then I had other friends that just hugged me and said, you're going to get through this. You're a boss. You're going to get through this. You're a strong woman. And that's what I needed. I didn't want to hear that you're going to be okay. Please don't tell me I'm going to be okay because I know that I'm going to be okay. But those words, saying that to a cancer patient, is like kind of the worst, I know I'll be okay. Just give me love and say, I'm here for you. I'm here for you, and we're going to get through this, and we're going to eat all the cookies or whatever it is that you need, kind of thing.
What makes this particular center such a step forward in the treatment of breast cancer?
I think it's a combination of things. Number one, I think we have really talented staff and clinicians that are truly committed to the care of women in our community. The few men, because there's also men that have breast cancer, and making sure that we stay up to date in the standard of care for breast cancer, that we explore the options that are available for them in the different areas of treatment. And most patients will need a surgeon, for cancer that is early treatable, not metastatic disease that has spread to other parts of the body. They will also need typically a radiation oncologist, which is a doctor that focuses on radiation to prevent cancer from coming back locally, in the breast or regional lymph nodes. And also a medical oncologist, which is a doctor that deals with systemic therapy. And the systemic therapies can be chemotherapy, can be immunotherapy, and immunotherapy is medication that, so to speak, is like helps your immune system fight cancer. And also endocrine therapy, which are typically in the form of pills that are taken for women that have an estrogen receptor positive or a hormone receptor positive breast cancer.
Were you prepared at all for what to expect?
I mean, minus the chemo appointment with the cancer center. No, I was not. I wasn't. I didn't know I was going to lose my arm hairs too. I didn't know that I was going to possibly lose my toenails and fingernails. I didn't know that how bad the chemo affects your body. And can I just share actually that I had a naturopathic oncologist on the team with Dr. Luckeroth and Dr. Tiffany, and having her teach me to make bone broth before chemo treatments will really help get nutrition in your body and just get stuff in your body before chemo, because you're gonna lose your appetite after chemo. And so I did a lot of bone broth. I made bone broth for every single treatment and vegetable broth, and I would take it to treatment with me, drink it during treatment, and up until my mouth wasn't up, you know, it was too sore to drink it. What else did she there was a lot of natural things that I was doing that really helped, that I would love to share with other cancer patients. Whenever I hear somebody's going through cancer, I'm like, oh my gosh, can I please help you? Can I please tell you about the magic mineral broth? Can I please tell you about the things that can help you hopefully tolerate the chemo just a little bit better? It's not gonna make it better, but it's gonna help.
You worked with a nurse navigator. What was that like?
Let me tell you how wonderful that was. So we're going to go back to that ugly phone call that I got from my naturopath, that you have cancer. You are going to hear from the cancer center is what he had said. I thought, well, what the heck is a cancer center? Who is that? Who's calling me? And this wonderful lady named Kathy Wolf called me, and she is the nurse navigator here at the cancer center. And she brought me in and connected me with my doctors, Dr. Luckeroth and Dr. Tiffany, and also gave me all the things that they provide to us as patients of cancer. There's workout classes, there's support groups, we have a new body now, and prosthetics are a thing now, and so you can come here to the cancer center and they will fit you for free. They'll give you bras and prosthetic breasts. Kathy let me know about all of this. I wouldn't have known any of this was a thing if it weren't for her. She also, you know, there was times that I just felt like I just needed to see somebody at the hospital. As weird as this sounds, when you spend a year at the hospital, you know, I'm here 3 times a week, it's kind of home to me. And so there were times that I missed the hospital, so I would just come see Kathy, say hi, just see how she's doing. And yeah, but even that, back to Kathy, you know, she let me know about the hats, the free hats that they have for us when we lose our hair, and they had wigs for us if we wanted wigs, and all these things that are so expensive. Is so nice to know that they have it for us right here and for free. I came home with 5 new bras. I probably got 3 prosthetics, and I could have had a wig. I chose not to. But I have a plethora of hats that there are wonderful people that make the hats for us, that they donate them. And so the nurse navigator was really a big part of all of this. It was having her be the first person I talked to, such a friendly voice and a wonderful, she was so sweet and kind, and she kind of made me feel a little relaxed, like, okay, this isn't gonna be so bad. We're gonna get through this, it's gonna be fine. And I have everything I need right here.
Liz, how long have you been here at Salem Health?
I have been at Salem Health since 1995. I came here straight out of nursing school with the hopes of landing an oncology job, and I did.
And you've been with oncology ever since?
Ever since.
Tell me, this whole new breast cancer center is a big deal, and the position of nurse navigator is considered one of the most important, and you are a nurse navigator. What is that?
It's a good question. What is a nurse navigator? It's a relatively new position in the oncology world. We started our navigation program in 2007, and we were really pioneers. And we started it because we saw a need, there was a gap, that patients weren't getting their needs met from the inpatient world to the outpatient world, or from diagnosis to when they saw their providers. People just had so many questions and so many needs, and there was really nobody there to pick them up and answer the questions, get them what they needed, and walk alongside of them through the journey, making sure that they were getting what they needed and that things were making sense.
What is this job like on the job of nurse navigating?
Yeah.
When the patient, you answered their questions, what next? You stay with them the whole journey?
We do stay in touch with patients, and we'll get in touch with them incrementally at key points in their treatment, so that when we know they're going into a new phase and they're going to have more questions, we'll give them a call. We'll set up an appointment. And so we'll stay in touch sometimes every 2 or 3 weeks, potentially for a couple of months, till we feel like people are on their feet. They know they can call us, and they call us freely when they have questions. And then at the end of treatment, we'll meet with them to go over what's called a survivorship appointment. So come back, get together after all of their treatments, and talk about life after breast cancer, and what to expect, and what the follow-up will look like.
That's interesting. Life after breast cancer. What do you know that they need to know?
Oh, there's so much. And again, we tailor the meeting to what patients' questions are, what their concerns are. But we want them to know what their follow-up will be with their providers, the frequency, the imaging, and then all of kind of the normal emotions that can come. Being a survivor, you know, oftentimes people go through treatment and they do what they need to do, and it doesn't really hit them till after treatment, everything they've just been through. And so their family and friends may think life is now going to get back to normal, and the patient is like, life is anything but normal. And so kind of finding their way again.
Do you involve the family at all?
Absolutely. If the patient wants the family involved, you bet. But it's patient driven, so we leave it up to them how much they want the family to be involved. They're welcome to come to any meetings with us. People put me on speakerphone for their family to hear all the time. So it really is a family crisis. You know, a health issue is, you know, such a serious thing. It affects everybody. So most of the time we are meeting with patients and their loved ones.
You make it sound as though there are phases that a cancer patient, from beginning to end of their treatment, goes through. How long does it take, roughly?
To go through treatment for breast cancer?
Mm-hmm.
It depends on the diagnosis and the type of treatment that's offered. But it could be 6 months. It could be longer, depending if they need systemic therapy, like chemotherapy. But most people will have some type of surgery, followed by possibly radiation, chemotherapy. So it's different depending on the diagnosis, but 6 months is not unreasonable to think that your life will have this interruption.
Our breasts are really special to us, right? We feed our babies with them. These are moments that you're never gonna be able to let go of, and so that was the hardest part for me, is knowing that something that I kept my babies alive with was going away, and does that change my body and what I look like, and are people gonna look at me differently? I have the choice to wear a prosthetic breast. I choose not to. I just don't like it. It feels uncomfortable to me. So I have embraced my new body. And I've gotten strong from it, I will say. Losing this breast and embracing this and walking around with one breast and knowing that sometimes my outfit shows that there's one breast and sometimes it doesn't, has really brought a lot of strength to me. And I think to myself, when people look at me, I may not have a breast, but I'm alive. I'm alive, and I'm healthy, and I have hair now, and I feel great. I'm working, I'm running. I can't even, that right there, back to hiking and getting outside and all the things that I loved to do before I was diagnosed, that all went away. You know, I was so sick that I couldn't do anything. I was too weak to even walk to my restroom alone. So all of that And then getting through chemo and slowly getting your strength back is really nice to get out in the woods and smell the air and feel it. It's a different scent and it's a different feel when you are coming back after such a strong battle and walking and getting out there.
Am I understanding you correctly that every breast cancer is unique?
Breast cancer, I think, is a label for a disease that happens in the breast, and it can have different manifestations. So it's not one disease. And I think that as we are moving forward with more and more research, we're realizing that it's really important to know not just whether you have an estrogen receptor positive breast cancer or a hormone receptor positive breast cancer or a HER2 positive or negative breast cancer, but also looking at the genomics, studying about what are the genes or the combination of genes that went wrong on that cancer cell or that tumor, so that we can better use systemic therapy and other tools to treat it appropriately and try to do more personalized and customized care. So it's about treating adequately, also trying to minimize unnecessary treatment, which can affect quality of life and then make that journey maybe unnecessarily more difficult than what it has to be. So it's really looking at all those things. It's not just one process or one disease. I mean, for some women, it was even 40 or 50 years ago where you were doing what we call radical mastectomies. And what does that mean? A radical mastectomy was taking the breast, removing the muscle, the pectoralis muscle, all of the lymph nodes, sometimes even removing the skin and trying to borrow skin from one place to another, which that was being done to offer women, a very small number of those women, cure. So there were going to be many more women that died of cancer, that had terrible side effects and complications from our treatment, to offer a very small group of those women the possibility of having cure. I mean, that is something that is not in my repertoire of surgery anymore. And it's not because we can't do it, it's because we don't have to do it.
What gives you the most optimism for this approach?
I think that as we continue to do more quality research that looks at the different treatments that we do and what improves survival, how can we minimize side effects of our treatment, when is it safe to de-escalate? For me, in the last 5 or 6 years, there's been research that is affecting how I practice medicine. Let me give you an easy example. Typically, when a woman comes in with a stage 1 breast cancer, an invasive cancer, they need their lymph node sample. So it's not just taking out the tumor with the surgery, it's also sampling their lymph nodes. And we are finding more and more about the tumor biology in some women, especially those that have a favorable tumor that is small in size, that is hormone receptor positive, estrogen receptor positive, is HER2 negative, and they are of a certain age. We know that we do not need to routinely take out lymph nodes if they have a normal clinical exam. We don't feel enlarged lymph nodes. And if in addition to that, we are doing an ultrasound before surgery to make sure that we don't see abnormalities of their lymph nodes surgically, it's very safe to tell them that they don't need to have lymph nodes removed. And they can just have the tumor removed and focus on that without affecting their potential for worse outcomes in terms of survival, or they're not at in a large risk of having cancer of the lymph nodes later on as they complete their radiation and they go on endocrine therapy, which is medicine to prevent cancer from coming back. So it's great to be able to de-escalate surgery, minimize pain, decrease the risk of lymphedema, which is swelling of the arm when we remove lymph nodes, and the more lymph nodes we remove, the more patients have that risk, or chronic nerve pain, and give them give them the option of having a more limited treatment without affecting the bottom line. Survival, and we're also adding to quality of life after treatment or during treatment. So to me, I think that that's very rewarding.
There's a lot of big decisions and big choices to make. You know, I could have done a double mastectomy. I chose not to. It was nice to talk to Dr. Luckroth about that and talk about my options. What does it look like if I do remove both breasts? What does it look like if I keep one? Having her to sit down and talk with me about that and how that looks and prepare me for what I was coming into was really, really nice. The amount of time that they spend with you here is, you can't compare. You really can't. I think cancer's not the worst diagnosis, and you will be okay. You will be in good hands here at Oregon Oncology. They will take good care of you. They will check on you. They'll make all your appointments for you. They'll bring you snacks while you have chemo, blankets, pillows. I mean, I'm making it sound great, and it's not great, but here it was. Here it was. I felt safe. I felt good. I knew I was going to be okay.
A key complaint for breast cancer patients and survivors involves changes in cognition, including the ability to concentrate, learn new things, or even remember. Salem Health is part of a National Cancer Institute clinical trial to determine if computerized cognitive training can improve cancer-related impairments. Salem Health Clinical Research nurse Cheryl Labronte says patients and survivors are participating. Many have voiced their concerns about these issues.
Sure, they're very frustrated because they go to their doctors, they tell them, you know, my brain's not the same it used to be. I can't remember where I set my keys. I can't remember my appointments. I can't remember my grocery list. I can't, just multiple things over and over, and the providers don't have any resources for them to help them with figuring out what the problem is. Lots of times they get the answer of like, oh, it's the normal aging process. Oh, it'll be okay. Hopefully it'll go away, you know, in a few months. But what happens is it doesn't. And so there's just lots of frustration and disappointment that they aren't the same person before as they were before treatment. And they've lost quality of life because they no longer feel like they can mentally have the capacity to do the things that they did before they were diagnosed.
As we've gotten better at this treatment process, we're starting to find that it's impactful on people's lives in the later end. And so it's finding evidence-based ways to help support their quality of life. You know, you talked about how people, you know, don't we know there are ways that you can help with your thinking? Well, we want to make sure that it is applicable for patients that have received certain types of treatment. Those are impactful on people's cells in their body, and so sometimes that can affect their brain as well. And we want to make sure that what we suggest to patients and ways for them to sort of deal with these cognitive issues is actually evidence-based and not just something we've come up with out of nowhere.
And that's what clinical trials are all about.
Yeah.
It's about to bring about evidence that proves the question at hand. And so the question with this trial is, can these computer-based cognitive training modalities actually improve the outcome for our patients and have an effect on their cognitive ability and their quality of life overall? There's two different modalities. One is based on a concentration, and which also deals with the neuroplasty theory of cognitive training, and then the other one is based on concentration, and that's the one where there's more games, Sudoku, those type of you know, training to help with memory and things like that. So fortunately, none of us know which training the patient's getting so that statistical outcome can be very unbiased and more pure. With this type of trial, the patient is actually active themselves in their, I guess I'll call it a treatment, for their cognitive impairment. So they are actively involved in doing the training. They can determine, they have 4 hours a week that they can determine how they're going to lay out that 4 hours to do their training. They're in control of that. So there's a lot of self-control in that. The other thing is that I think it's very important to them that, there is treatment that is being investigated and studied, because part of this study does show that they did pilot studies prior to opening this study, which did show that this type of training has had an effect and had positive outcomes for people in smaller study samples. And it also showed that not only did it help with the cognitive improvement, but it also helped in other areas of quality of life, such as reducing depression, anxiety, stress. So all of those things. And if someone can have control over doing their own plan of reducing those things and increasing their own cognitive ability and not having to rely on someone else or a pill or another, type of treatment. I think there's a lot more self-control with this, in knowing that you can go and do this without relying on anyone else to.
Interested in learning more about participating in the clinical trial? Patients can talk to their oncologist or nurse navigator for a referral, or they can call the Salem Health Research Department directly at 503-814-1438 or email clinicalresearch@salemhealth.org. Breast cancer patient and survivor artwork adorns the Salem Health Breast Cancer Room and changes every month, a showcase of their art in every room in an environment fully supporting beauty and hope. And there is reason for hope.
Our survival continues to improve the earlier we detect these cancers. Some cancers, we can even detect them when they're technically a stage 0. And people ask me, well, how can you have a stage 0 if I have breast cancer? Well, maybe we're detecting it with mammograms before the cancer cells break away from the gland, the lobules or the ducts. And so we are detecting it so early that we can potentially remove it with surgery, do radiation to prevent local recurrence before they have the potential to break into our body somewhere else and be hiding and then come back to haunt us.
What are some of the warning signs that people should get checked out?
That's a great question. Most patients may not have warning signs until it's a little bit further out if this lesion has been growing, we have not been doing mammograms on a regular basis. There's some women that may have a more superficial tumor that even if it's small, you can palpate it and feel it. So in reality, being familiar with your breast, it doesn't mean that you have to be constantly checking, but do exams on a routine basis yourself. Look at the shape of your breast. Make sure that you're not seeing that one breast is retracting or getting smaller or getting larger than the other one, that you're not noticing skin dimpling or nipple inversion, that you're not feeling suddenly a change in the texture of your tissue or of your breast. And when you compare it to another part, it's different, or the other side. Those are things that can give us signs of that we have a problem. Is it going to be breast cancer? Not necessarily. There's other entities of the breast that can cause changes. Making sure that you're not having nipple discharge. And I'm not talking about nipple discharge like white or yellowish. I'm talking about almost like transparent yellow or bloody. And that is spontaneous, that it stains your nightgown or your bra during the day. That's coming out of nowhere. So those can be signs of breast cancer. but many of us will not have signs of breast cancer for a long time until this is really left unchecked for a while. And that's why we do mammograms. We want to detect them before it becomes symptomatic.
And I think the biggest thing I've had to overcome is I don't want to wear this prosthetic breast. It's hot. It's heavy. I don't want to wear it. This is my new body, and I'm just going to wear it. I'm going to wear it the way it is, and I'm going to be confident about it. And that is what I've been doing since day one. I think I've worn my breast twice, and I didn't like it. And I some people notice, some people don't. And when they do, my hope is that if a woman sees me and she is going through this, I hope that she gets some strength from me, and I hope that she feels comfortable to talk to me. Ask me all the questions, ask anything you want. I am here to help make this as beautiful as I can. We need cancer survivors to help other cancer patients through all of these decisions, all of the support, talking to our families, talking to our friends, talking to our coworkers. Yeah, and talking to each other, because, you know, I've met a few. I think I said I was the youngest one in the room, but I did meet a couple people my age with cancer. And it was nice to have people my age with cancer. It was nice to have somebody to talk to, because we tend to talk about what we're going through, and to have somebody that understands it, that is, it's irreplaceable. I get so emotional when I meet somebody that has gone through cancer. Instantly, I'm almost teared up. As soon as I know that and it's weird, we both know, it's this connection that we both just like, we understand, nobody else knows. Nobody understands what we've been through. And it's just this connection that you just can't explain. And no one else has that. You guys don't have that kind of connection when you meet people, but when we do, our people, I want to say, it's really it's wonderful.
And how has this changed your family and the dynamic with, what have you all learned from this? What's new?
Life is very precious. Life is very precious. Cancer doesn't discriminate. We've learned that you need to take life a little bit slower and smell the roses. Be nice to people. Kindness goes a long way. I think one of the biggest things my son learned is you never know when somebody is having a hard day, and you don't know when somebody is sick with cancer. And so you need to be kind all the time. Seeing me go through cancer in the days that I was so sick, but no one knew, he knew, it was an eye opener, you know, to remind yourself that we don't know what everybody is going through. We don't know anything about the people that we're sharing a room with or walking through a grocery store with. And so that was the biggest part.
I have to ask about the beautiful flowers. Tell us about that.
I got the flowers a few years ago, and then I added my son's handwriting. And this actually was while I was going through the cancer. I just wanted to have him closer to me. And so his handwriting is tattooed on my wrist, and I look at it every single day. And there were days that I was so weak and just broken, and I would just look at my hand, and the love came through, you know, it's strength from all the places.
And just to remind us that Salem Breast Cancer Center is within a hospital, another journey began as we were talking.
Memory, the ability to learn.
Wait a minute.
Yeah.
I think we're going to have to stop there for a second.
There's a baby being born.
Oh, that's beautiful. That's what they do.
They do. This is, yep.
Welcome to the world.
Uh-huh.
Oh, that's wonderful. You might leave that in.
So not only do we treat cancer here, but we also take care of our new babies.